Hello everyone. Topic for today is implants or so-called dental implant. In layman language, people call it tooth with a screw attachment. Want to know about it? Let's move ahead. Firstly, the definition. According to GPT-9, which is Glossary of Prosthodontic Terms, ninth edition, so it is basically a dictionary. And according to it, what is implant? It is any object or a material or some other tissue which we partially or completely insert or graft into the body. Body here is any region where tooth or any other material is to be added or implanted, either for therapeutic purposes, diagnostic purposes, or prosthetic purposes. The dental implant is not the only implant. There are various other implants you can see all over the body, be it eye implant or any tissue implant or bone grafting. It is also a part of implant, and our main focus for today is dental implant. There are total 8 stages of dental implant. Let's begin. So our first and foremost stage is flap designing, incision and elevation. At first, the area where the implant is to be made, it is seen, and then site preparation is the most important thing. If the ridge is not suitable for implant, for example, if the ridge is a flabby ridge or there is bone loss there, at first bone grafting will be done or flabby ridge will be corrected surgically to make an implant. And then flap design, incision and elevation is done. Now what does it mean? It means that a design will be selected to raise the gums or mucosa covering the ridge. Either it may be triangular or according to the site as seen here. And then incision will be made. You can see here the incision is being made. And then the mucosa, it will be elevated. You can see here the elevation. Now incision, it is either crystal or remote incision. There are various types of incision and the incision used here is these two. Now flap, it will be raised either buccally or lingually, and it is raised onto the level of mucogingival junction. And then elevation is done with the help of periosteal elevator, you can see here. Then second step is implant size preparation. Here series of drills are used to prepare the sites. Round burr, 2 mm twist drill, 3 mm twist drill, and there are some others too. But most commonly these are used. You can see the video here. The drill is being done. And then is implant insertion. It is inserted with the hand piece which is rotating at a slow speed. You can see here. And the fourth step is closing of flap and then suturing it. The flap that was raised will be back to its original position and then suturing will be done. Here is the video. Once it is inserted, the flap is closed and the suturing is done. After this, patient is advised to have course of antibiotic treatment for 1 week. Why? To prevent any bacterial activity which can lead to infections further. And amoxicillin 650 mg per day is mostly used and given. It is the drug of the choice, you can say. And maintenance of oral hygiene, it is very, very important. You should take care that there is no food lodgement in between your teeth so that no bacteria proliferates in your mouth, and you should rinse your mouth after every meal. Now sixth step is osseointegration. Osseointegration means connection or attachment of the osseous tissue or the bone tissue to the foreign material that is being inserted. So here is the definition: the apparent direct attachment or connection of osseous tissue, that is the bony tissue, to an inert alloplastic material, which is the implant which we are inserting, without intervening fibrous connective tissue. So fibrous connective tissue should not be intervened, because osseointegration will not occur in a proper way if there is fibrous connective tissue in between. It should directly attach to the bone. You can see the diagram here, and here comes the video. Once the implant is being inserted, the process of osseointegration begins. It takes some time, approx 3 to 6 months, and the seventh step is abutment placement. It is the part of the structure that receives a thrust or a pressure. It actually acts as an anchorage or a support. It can be of various types: angulated, healing, dental implant abutment. You can see exposing the implant. How it is done: at first we will expose the implant, take out the screw, place the healing abutment, and then we'll change it to final abutment, and this process takes about 4 to 6 months. See, after 3 to 6 months, once after osseointegration, that is after 3 to 6 months, we change the healing screw to the gingival former, and then after 2 weeks we change gingival former to the abutment, and healing of gingiva takes about 2 weeks. And then now abutment is being placed. And then 8th step is prosthesis placement. How it is done: at first we take the impression of the dental arc, and then we prepare study model to make the prosthesis extraorally, and then we have trials of that extraoral made prosthesis into the patient's mouth. Then is trial of the prosthesis, if it is fit or not, or any other changes are required or not, and then final prosthesis is made. At first we will take the impression, and then study models will be prepared. We will fit the crown. This is how implant is done. These are some cases. It can be done either in a single tooth or for the complete arc at various anchorage sites. This is the implant. You can see it is one of the models. This is how it looks, the pinkish colored highlighted tooth. It is the implanted tooth, and this is the whole video. Again, you can see we are inserting the implant first after flap incision and elevation. The osseointegration process will begin here. After 3 to 6 months, we are changing to the abutment. Two weeks healing period of gingiva. Then impression is being taken. Crown preparation and fitting after trials. And then the implanted tooth is ready. Thank you for watching. If you like the video, do like, share and subscribe.